Hello, welcome to HRT or Not month. I'm chatting with Hannah Charman. Hannah, do you want to tell us what you do, and then we'll get onto the topic?
Yes, so hello, thank you very much for inviting me to join you today, for enjoying me as well.
Well, absolutely.
It's going to be one of them, isn't it?
It's going to be one of them. It's all good.
Yeah, so I'm Hannah. I'm a medical herbalist by background. So I trained to the same sort of level as a GP, but in herbal medicine instead of mainstream medicine. And that was about 25 years ago now. And since then, I've come to specialize in menopause, and I've also brought health coaching and advanced hypnotherapy into my practice as well. So depending on what each patient needs, we sort of blend together all three so that we're working on mind, body, spirit, soul, all at the same time. And we normally get a pretty big improvement within 8 to 12 weeks.
Awesome. I'm just going to, before we get started onto HRT, I'm going to just ask you a little bit more about medical herbalism.
Yes.
Because I think we need to just get that clear for people watching.
Mm-hmm.
So obviously in sort of mainstream medicine, I don't know if that's the right sort of term, everything's already pre-packaged up, isn't it?
Yeah.
You get the dose of the pills, of the medication, and off you trot. And if it suits you, it suits you, and if it doesn't, it doesn't.
It doesn't, yeah.
Whereas, correct me if I'm wrong, you tailor it to each person.
Yeah, that's right. So mainstream medicine is a kind of one size fits all. You've got a very limited number of options, and like you say, it will either work for you or it won't. With herbal medicine, it's all about the patient and what they need and their constitution and where they're at the time. So all of the medicines I use are blended together, especially for the patient. And often if they come in for a first consultation and they've got 60 different menopause symptoms going on, we say, okay, well, where do you want to start and how do you want to prioritize, and then build the prescription around that. So but in terms of the actual constituents of the herbs and the drugs, there's a lot of crossover between mainstream and herbal. So a lot of mainstream medicines like digoxin and aspirin and certain strong painkillers and some forms of chemotherapy are derived from plants. And actually menopause is the only condition that doctors are allowed to recommend herbs for according to the NICE guidelines.
Right.
So there you go.
Yeah, things you learn. So at the moment, there's been quite a swing towards HRT, I think it's fair to say.
Mm-hmm.
After there being quite a lot of years where there was a swing very strongly against it. And I suppose with all these things, there's sort of peaks and troughs, and people benefit and people don't benefit in the peaks and in the troughs.
Yeah.
But there is understandably still quite a caution around HRT, and there are people who either can't take it or don't want to take it. And I guess that's really where your piece of the jigsaw really comes into its own, isn't it?
Yeah, I mean, it's a really tricky thing, HRT, because like you say, we're given all this information about how great HRT is and it's much safer now than it was, which is true. And then they've also been saying that the study that was done in the 80s was flawed. That was the study that kicked off all the safety concerns around HRT. They've re-looked at that study and decided that it was flawed. I'm not quite so sure if it was as flawed as they've said, but for me, researching the safety of HRT would be a full-time job. It's an absolute minefield. So the new preparations that they have are certainly safer. A lot of people don't realize, though, that as well as the health considerations, there are also ethical and environmental considerations. So, for example, using long-term hormonal contraception and hormonal HRT, you end up excreting estrogen through your urine. And that can't be cleared out by the water companies. So that ends up in your rivers and your seas and your drinking water. And we're finding that one thing that's happening is that girls are starting menstruating much younger now than they ever have in the past. And we think this may be why. It's also affecting fertility of fish and other little animals that live in the rivers and the seas. And so, there's an environmental aspect to this as well. and also ethically. You know, pharmaceutical companies are not well known for being terribly ethical. And like all businesses, they're in it for the money. And when you look at the amount of money that can be made, not just through selling HRT, but other medications as well, sometimes patient safety kind of takes a bit more of a backseat and profit comes first. So it's just something always to bear in mind when you're making your decision. It's totally your decision either way, but just maybe look at the bigger picture before deciding, because there's a lot of these things that people don't necessarily realize. And I'd be very interested to see how things play out in the next 10 or 20 years, because so many more women now are taking HRT, albeit at a lower dose, but we have no long-term safety studies to say either way whether how safe that is and what the long-term implications of that might be.
And in a generation where we've taken the pill since we were young.
Yeah, I mean, it's interesting.
From the point of view of a researcher, actually, and I'm going off on a tangent slightly here, and I apologize, but actually from the point of view of a researcher, I guess it's quite difficult, therefore, to actually be able to pinpoint. I mean, yes, to say that taking hormones is beneficial or not, whatever the result of the research were to be, but actually to pinpoint it either at the contraceptive or at HRT, if you're looking at women who've got to HRT age, it's difficult to pinpoint, isn't it? I guess
it's really interesting. There's an endocrinologist in the US called Dr. Geraldine Pryor, and she has basically devoted her whole career to studying menstruation and menopause. And so her take on it is that actually HRT in most cases is obsolete. It's there as a medication for those women who genuinely do need it, but it's not, you know, it's massively overused and there are problems with it. So one of the things she said is that when it comes to protecting your bones after menopause, the key factor is your estrogen levels by the time you reach menopause, which depends on you having normal natural cycles for your whole reproductive life.
Right.
Obviously,
so
if you're taking
screwed
the pill,
from the age of 16.
Exactly. If you're on the pill or you're on patches or implants or whatever it is, you're not having normal natural cycles. So that blows it out of the water. So you would then, in theory, need HRT, is what we're being told, to protect your bones. So you're basically on hormones from late teens, early 20s for the rest of your life, if you want to look at it that way. Which, to me, my gut feeling is, and having worked in this area for so many years now, I think your body's really clever. I think human beings are designed to survive and thrive and adapt to whatever's going on around them. So I know we say, well, you know, 100 years ago, we wouldn't have lived probably even to the age of 40, 45. We wouldn't have even got to menopause. So now we're living so much longer, we definitely need these hormones to keep us going. I don't necessarily follow that.
Well, one thing that I will say around that is, and I hear this being said as a thing, that was always based on the average age. And that was because a lot of women died in childhood or in childbirth.
Childbirth was the biggest killer.
And those who got past that carried on living to a good old age.
Exactly. And I doubt they were all
the way that average has been passed on as fact is that everyone fell off a cliff at 45.
Yeah, I mean, you go to your local cemetery or graveyard and look at the old graves, you will find graves of women who died 200 years ago, 300 years ago, who were well into their 70s, 80s and 90s.
Yeah.
And I would imagine that they were in reasonably good health. Yes, dementia did exist. Yes, arthritis did exist, but, you know, they would have had a much more wholesome lifestyle, perhaps not as good quality living conditions as we have now, but then their resilience would have been much stronger than ours is because of that, because they had more germs to deal with and more extremes of temperature and not such good food. So yeah, there's always more to this.
Yeah, absolutely.
And my gut feeling and my experience tells me that messing about with your hormones when you don't really need to tends not to end very well.
Fair enough.
Yeah.
So before we go right down that can of worms,
yes, rabbit hole,
I'm gonna pull us back. Yeah.
Yeah.
So in terms of anybody wanting to look at medical herbs for managing their symptoms.
Yeah.
You said earlier you start with kind of the most pressing symptoms. So as you know, I'm always encouraging people to track kind of the worst symptoms. So would that really help somebody when they come to you?
Yeah, I mean, during the first consultation, we do go through your whole medical history. So we go through every symptom you've got now and all the health conditions you've had in the past, back to birth, and sometimes we go into family history too. So by the end of that, we've built up a pretty clear picture of what's going on behind the scenes. And, you know, often women who are having problems with menopause, if you talk to them, they've had menstrual disorders going back decades, or they've had problems with dealing with stress or exhaustion or fatigue or something like that. So your body, like I say, is very clever. It's capable of healing itself if you give it the resources to do it. And that's what herbal medicine is all about. So to my way of thinking, they're intelligent medicines that you introduce into an intelligent body, and your body just knows what to do with it, and you get better. And I see this happen every day in my clinic and have done for a long time. So the way I build my prescriptions for menopause is I start with the background stuff. Start with rebalancing the hormones. Your hormones are supposed to fluctuate in menopause. That's the whole point of it. But they're, you know, it's like really uncomfortable if they're doing this. What we want to do is kind of make it a bit smoother and a bit easier on you. And then I also bring in herbs that will help you to deal with stress and help your mental health, because those two are very closely interlinked. And I think that that is an inbuilt mechanism that we have, because if you think about it, back in your cavewoman days, if your inner was perceiving that you were stressed, it would have been because you're probably in quite serious danger, either from, you know, famine or flood or attack from something sharp, a spear or an antler or something. So your inner would have put the survival of the species above your own survival in terms of priority, which means that if your inner is perceiving that you are in a life-threatening situation, it's not a great idea to bring a baby into that environment, is it? That's not going to work for the survival of the species. So the way it gets around that is it disrupts your reproduction. It will disrupt your menstrual cycle. And we all know that, you know, times we've been stressed, periods have gone up the wall for a little while. And that's a survival mechanism for human beings. There's nothing weird about that. And it just really helps if you can try and understand a bit more about what your body's doing. So that's why I always put herbs for stress into my mixes for menopause, because who isn't stressed these days? I don't know anyone who doesn't have some kind of stress going on. And then we can target individual symptoms as well. So there are specific herbs for hot flushes and for palpitations and for aches and pains and for fatigue and so on. And we build the prescription up that way. And hey presto, they get better, particularly when it's supported with, you know, good changes in diet, you know, good nutrition, both through diet and maybe a little bit from supplements if they're needed. Some good daily exercise. Exercise alone, 30 minutes a day, cuts your risk of dementia by 40%. Just doing that.
Yeah. Which, as always, brings us back to get a dog.
Yeah.
Which is always it's always
Yes.
what I encourage everybody. Just get a dog.
Get a dog.
You have to go and
go
walk
wrong.
for 30 minutes a day, you know.
Yeah, exactly.
And my dog's barking.
Yes. But, you know, this is not something that's very widely publicized, is it?
No.
If we were all told this, we'd all be out walking or doing something for 30 minutes a day, wouldn't we?
Yeah.
I would.
Yeah. Yeah. Yeah, absolutely. So, and I think in all of this, we've kind of hit the nail on the head, I guess, that the one size fits all version of mainstream medicine is designed to just keep everything really simple and, I mean, cynically, to make money for the big pharma firms.
Designed to keep you sick is what it is.
Yes, designed just to keep piling things up to. Whereas your approach is actually to heal the body.
Yeah, it is, and it's not just about menopause either. It's like, you know, we all talk about menopause, but actually it's more than that. And menopause is quite a narrow window of opportunity to get your health straight for the rest of your life.
Yeah.
And I think if ever there was a time to stop and invest some time, and if you have it, some money in getting yourself sorted, this is it. And apart from anything else, you probably put everybody else first.
Yeah.
Since forever. You know, you'd have put the kids first, or the elderly parents, or your career, or something before your own needs. We all do it. And there reaches a point where your body goes, no. And actually, I wonder with things like energy levels and fatigue in menopause, again, is that a safety mechanism? Is that your body putting the brakes on and saying, do you know what, enough's enough now? You need to have a rest.
Yeah.
And it's unrealistic for us to expect to kind of live like a 20-year-old when we're 50. It's life ain't like that. I can't do the things now that I could do even 5-6 years ago, let alone when I was 18.
No.
And I think that's
and I'm glad
how
I
we're
did all of them
designed.
when I was 18. I mean, I had a great time, but
Yeah, exactly. But that's what we're designed to do. You're not meant to be running around like a headless chicken when you're 90 years old. You know, we're not meant to.
No.
So sometimes it's a question of stepping back and actually looking at what's going on and where you're at, and actually, do you want to be running around for 16 hours a day every day? No. Thanks.
And one more thing I'm going to quickly say, which I quite often say when I speak to different experts, is that I see this a lot in the Facebook group, people going, what supplements can help me? But obviously nobody answering those has the medical history of that person or the lifestyle history of that person.
Exactly.
And I think there is so much benefit for every single woman in going through the menopause transition to take an hour out of her life to speak to somebody like you or a naturopath or a nutritionist, whatever it is that sits right for them, and understand what their body needs, not what somebody down the road needs, not what somebody on the internet needs, what they need.
Exactly. And actually, you know, I was thinking about this a while ago when I had my horse accident, and I could easily have just snapped my neck and died very, very easily. Thank God it didn't happen. But, you know, I just thought, oh my God, so many people are depending on me to show up every day. I'm a carer for my son. And yeah, if I wasn't here, my partner would probably muddle through, but it would be very difficult because he doesn't know how to do half of it.
Yeah.
And I have a whole big bunch of patients waiting for me to show up, and I have an employee, and I have a partner, and I have parents. And God, what would happen if you one day couldn't get out of bed? You know, what impact would that have on those people around you? And is that not worth thinking about?
Yeah.
Are you not worth that investment?
But yeah, absolutely.
At this point, when you've probably never done it in the past. So yeah.
And on that very, very pertinent note, I'm going to say thank you very much, because I think
Thank you.
Better that.
Yeah, it's been fun. But I'm just really, I'm on a mission to get to those women who are struggling and can't take HRT or don't want to take HRT for whatever reason, just to say, look, there is an alternative and it works fast. And that's there if they want it. I've had so many patients who've been at their wits' end, and some have been suicidal, and some have lost businesses and careers and so on. It's been really sad. And you just think, if you'd just known that before, you would never have gone down this road. So anyone you know who might need my kind of help, you're welcome to book a free call with me. And there's no obligation to sign up to anything. It's just a chat and just to explore some options. So yeah.
Awesome. And your details will be coming up in just a second.
Mm-hmm.
Thank you so much, Hannah.
Thank you.